At least about one person died every minute due to HIV-related causes in 2024, and South Africa remains at the center of this crisis, carrying the largest share of the global burden. And now a groundbreaking HIV prevention drug could soon prevent hundreds of thousands of deaths around the world. To address this crisis, Global Health Initiative, UNITAID and the Gates Foundation have entered into agreements to produce cheaper generic versions of HIV drug lenacapavir. Now, the generic drug will be available at $40 a year in 100 different countries starting from 2027. The drug reduces the risk of HIV transmission by nearly about 99.9% and is said to be 700 times cheaper than its branded alternative. Now, the sharp reduction in pricing comes as a significant boost to global efforts in countering HIV infections globally. And around 41 million people were said to be living with HIV, and at least about 630,000 deaths were recorded in the year 2024 due to the HIV infection.
Today's price, the announcement of the price of the generic at $40 per person per year for the injectable, brings it to the level that countries and communities have asked in order to unlock the demand and attain the levels of protection that are needed.
In South Africa and across the sub-Saharan part of Africa, HIV remains a major challenge. Prevention and treatment programs have expanded over the years, and yet new infections are on the rise. They continue to grow faster than the number of deaths amongst the people already living with the virus. And according to reports, by early 2025, about 8 million people in South Africa are said to be living with HIV. And that number accounts for about 12.8% of the country's population. Now, globally, women are at the highest risk of HIV infections, and according to the United Nations, women accounted for 45% of all new infections globally. The situation is worse in the middle and low-income countries, particularly in sub-Saharan Africa, where women account for over 63% of all new infections. And WION's correspondent Calvin Ongmu has sent us this report from Johannesburg in South Africa. Listen in.
Lenacapavir provides months of protection against HIV infection. The drug has been hailed by several leading experts as game changers with the potential to help end the HIV epidemic. But in South Africa, the country with the highest HIV infections in the world, lenacapavir is not yet widely available. The National Department of Health plans to roll it out in public clinics starting in April 2026. Scientists reckon if enough people take it, lenacapavir could bring South Africa's HIV epidemic to a halt. The price slash has also been welcomed by many, saying this is expected to give millions access to the breakthrough treatment and potentially bring the world closer to ending the HIV. This is Calvin Ongmu from Johannesburg, South Africa for WION The World is One.